Judy Melinek saw it coming. The forensic pathologist was running a large county morgue outside San Francisco when she saw how America was failing to control the virus. Dr. Melinek knew the U.S. death toll would be astonishing, so she escaped to the opposite side of the earth.
You saw how the coronavirus numbers were climbing in the US, and you picked up and moved to New Zealand.
Yes, exactly. With my family. I picked up and I moved. And within about 2-3 months.
That was June, when the U.S. death toll was just breaking 130,000. But here we are in September, and while the official tally of 200,000 deaths is devastating, it's not the whole picture, not even close. Experts say that number misses as many as 1 in 3 people who died from some pandemic-related reason.
There is an undercount in the United States of the deaths due to COVID-19. And the reason for that is because we do not have sufficient testing in the United States to capture all the deaths.
Then there are those who may have never contracted coronavirus, but who perished due to the massive disruption in our lives.
If I had something like an asthma attack, and I didn't think that it was super severe, like if I'm a chronic asthmatic and I thought I could manage it, I don't want to go to a hospital and potentially get COVID.
So as the U.S. passes this grim milestone, how do we take stock of what we've truly lost? To get a full picture, epidemiologists use a concept called excess deaths. Leave coronavirus aside for a moment. You start by looking at historical data. How many people in normal times die of all causes? You subtract that from the number of actual recorded deaths this year. The difference between those numbers are excess deaths, above and beyond what you'd expect.
You expect every year, every season, every month, every week, a certain number of people in the United States to pass away. And one of the things that we saw during COVID was that really spiked.
CDC data show that for the first week of August, you'd normally expect about 52,000 deaths. But this year, early data shows more than 62,000 deaths that week, a difference of more than 10,000 deaths. But only about 7,000 COVID-related deaths were actually reported that week. That leaves another 3,000 or so deaths above the average, but not marked as COVID. We've seen this play out before. When Hurricane Maria lashed Puerto Rico in 2017, government figures put the death toll at 64. But excess death figures showed thousands more unexplained deaths in that period. Eventually, Puerto Rico revised its figures. I wanted to know how many COVID-related deaths we might be missing. So I spoke with some of the country's top biostatisticians. Dr. Christopher Murray runs the Institute for Health Metrics and Evaluation at the University of Washington. The so-called IHME model shows that total mortality is between 50 and 65% higher than the official counts.
So for every 2 people officially counted as having died from COVID, there's a whole additional person who was not counted.
There's a whole additional person that we can probably trace their death as related to COVID and also the lockdowns from COVID.
Based on your modeling, when did we actually hit 200,000 deaths in America?
Sometime at the beginning of July.
Do you have a number at this point of how many Americans in total we believe have died?
Soon getting close to 300,000.
300,000 Americans since the beginning of this year.
As many as 100,000 undercounted deaths. But many Americans don't believe it. A QAnon-linked conspiracy theory that says COVID deaths are overinflated has been gaining steam. It draws on recent CDC data showing 94% of people who died of COVID had what's called comorbidities, other conditions also listed on their death certificate. Skeptics spun that up to say only 6% of COVID deaths were actually from the virus. That's not what the data says. But President Trump even retweeted it. The misinformation was so blatant that Twitter actually took the tweet down. Still, 1 in 3 Americans believe the death count is exaggerated, according to an Axios poll this summer.
Having a comorbidity doesn't mean that you would have died anyway at that time, does it?
No, definitely not. Maybe you have another condition that would make you more likely to die if infected by COVID. If you have those diseases and you weren't infected, you may have lived a year, 2 years, 10 years longer.
We have to step back and ask ourselves, why are we quibbling over the numbers when we know that this is a terrible virus that kills people? Even one death, if it's your grandmother, if it's your child, if it's your uncle, affects you. And it doesn't matter if they had hypertension or diabetes. They're your uncle, they're your child. We have to focus on the task at hand, which is how to combat this virus and how to make it go to zero.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.